for your baby's teeth are Dr. Mark Liebrak, patient Michelle Boyer, and the cutest baby on the planet, her daughter Alana. Alana, look at her. Hi. So, Dr. Liebrak, we're here to talk about this baby bottle syndrome that actually causes severe tooth decay in children. So tell us about that.
The message we want to get out to parents is that they should never put a child to bed with a baby bottle that's filled with anything but water. If they need to put the baby to bed to pacify the baby, it only should have water in it. The problem with putting milk or anything acid like juice in it, it bathes the teeth in acid, breaks down the enamel, and severe tooth decay can happen.
And so we brought one of your patients, and you're going to tell us your experiences of making sure that you care for your child's teeth. So tell us about your experience.
So I asked Dr. Liebrak at what point should I bring Alana in to see him. And he explained to me that when she gets her first tooth, or if she's one, whichever one comes first. So when she got her first tooth, we brought her in, and he explained to me that our bedtime routine was that I would breastfeed her, and she would fall asleep, and I would put her to bed. And he explained to me about the tooth decay. So we had to change bedtime routine, and so I would then breastfeed her, and then we would go brush her teeth, and then she goes to bed.
So how old should they be when you start brushing their teeth? I guess as soon as they have teeth?
As soon as you see that first tooth come in. Teeth are susceptible to decay as soon as they enter the mouth. And so it's very important to start off right at the beginning with a really good regimen of taking care of your teeth. And that regimen that you start with a child can last them into their adulthood. So for example, we suggest that you brush a child's teeth just before they go to bed, just after you've done the last feeding, whether it's breastfeeding or whether it's done by a bottle. And then we ask you to do it right after the first feeding in the morning. So that way they can get two full feedings, two full brushings before they have any more food in their mouth. So that will really help take care of their teeth. We also ask parents to floss their kids' teeth twice or 3 times a week. And you have to do this for your child. So we actually tell parents that they should make this a routine where everyone brushes their teeth together. So if the kids see the parents brushing their teeth and flossing their teeth, the kids will start flossing their teeth, and this will be a lifelong lesson.
Absolutely. And I know you brought along a picture that shows us what tooth decay looks like from baby bottle syndrome.
Okay, so this is a severe case, obviously, of tooth decay, okay? This doesn't happen with all baby bottle syndromes, but some can happen this way. And it's sad in this day and age that this could happen, because this is a purely and totally preventable disorder, okay? As long as the teeth are taken care of right from the start, then a child can go through an entire lifetime with their baby teeth and then their adult teeth without having decay. So brushing and flossing and taking care of their teeth and making sure that, for sure, that they do not go to bed with a bottle that has any form of carbohydrate in it, any juice, any milk, is very, very important. Never pacify a child with a bottle filled with those things.
What are the consequences of the big teeth if you have decay on your baby teeth?
Well, baby teeth are very important. A lot of people don't realize this. They think, oh, it's just a baby tooth, it'll fall out eventually. And that is true to a certain extent. However, a child needs these teeth to last them until they're 11 years old. They need to chew with them. They need to socialize with their mouth. They need to be seen by other kids. It's very important to them to have a healthy smile. It's also important for those teeth to stay in their position for as long as possible to create and keep the space for the adult teeth that follow. If you lose baby teeth prematurely, what happens is that teeth start to crowd. And if the crowding happens at an early age, then it means that their orthodontic problem that they didn't have is now becoming an orthodontic problem. So they may need to have braces when they never had to have them.
So many things to think about. And when it comes to this, let's say a patient suddenly comes and you see this decay, do you then have to pull those teeth?
No, in many cases we can restore those teeth. The problem is that you're restoring teeth on a young child. And to go through a case in which you have multiple cavities, it's very stressful on the child. And in many of those cases, we offer a sedation route as opposed to doing it one by one. It's very stressful for a young child. You can imagine working on this young child that really doesn't understand very much to try to repair this decay. So technically, we take the child, we put them to sleep, we get all the treatment done in one shot, and then that way they're back to a healthy start. But I want to stress that none of that treatment would have been necessary had the teeth been taken care of from the get-go.
Well, thank you so much for being here. You might have helped many kids with their winning smiles down the road. Thanks so much.
Thank you.
UIT's Student Law Association student